Our first panel will discuss reporting of COVID-19 data in popular media and how governments leverage data to manage the pandemic. The panel will be moderated by Subhra Priyadarshini. Subhra is an award-winning science journalist and the chief editor of Nature India. She's worked with several India media houses and now mentors budding science journalists through the India Science Media Fellowship. Thank you, Subhra. Subhra will be moderating the session. Our speakers are Professor Gautam Menon. Gautam is a professor of physics and biology at Ashoka University and IMSC Chennai. He's an award-winning scientist whose research covers a range of areas in physics and biology, including infectious disease modeling. He's written several articles on the interface of science and society, as well as on science policy. Our next speaker is Dr. Maulik Baxi. He's a public health and preventive medicine physician from Alberta, Canada. His public health practice interests are health protection, health promotion, and population health management, and his clinical specialty is addiction medicine. He's an alum of Columbia University in the city of New York, Johns Hopkins Bloomberg School of Public Health, and Yale School of Public Health. Our next speaker is Dr. Sandhya Koushika. She's an Indian neuroscientist currently working at the Tata Institute of Fundamental Research in Mumbai. Her main area of interest is the trafficking and transport of cargo within nerve cells. She coordinated hoax busters of the Indian scientists' response to COVID-19 and was the content convener of COVID Gyan. Our next speaker is Dr. Supriya Bezbaruah. She is a technical officer and lead for risk communication and community engagement at WHO's regional office for Southeast Asia. She has over 15 years of experience working with governments and non-governmental organizations in shaping and communicating complex issues of development, health, and science. Our final panelist for the day is Kuang Keng. He's an award-winning digital journalist, data journalism trainer, and media consultant. Besides training and consulting, he also runs the Malaysia Information Literacy Education, an organization that develops and conducts information literacy workshops for Malaysian students and the youth. The panel will take questions at the end of the session. So if you have any questions, I request you to please type it into the chat box and we'll pick it up from there. Over to you, Subhra.
Thank you very much, Anuja. Thanks to all the panelists for coming in for this really super, what I think is one of the most interesting panels of this Medical Misinformation Summit. Good morning, good afternoon, good evening to all of you. The rationale for this session today in the Medical Misinformation Summit is that after vaccines and the virulence of the virus itself, if anything has been under the spotlight or has impacted people's lives directly during this pandemic, it is data in its many forms: numbers, figures, models, projections, estimates, curves. These have evoked both hope as well as despair in equal measure in the last 8 months, 9 months for all of us. So I plan to conduct today's session with our extremely knowledgeable panelists in 3 distinct sections. And being mindful of time, we will divide the next 40 odd minutes into 3 sections of 10 minutes each, leaving some time in the end for questions from a global audience who have, I'm being told, logged in from almost 50 countries. So section 1, we will sort of look at reporting of COVID-19 data. Section 2, we will talk about data availability, correctness, and transparency. And section 3, the use of data by governments to make decisions. So let's go into the heart of reporting of COVID-19 data. During this pandemic, just as a context-setting exercise, I'll just take you through what we saw. We saw that the media, governments, and international organizations used a common set of metrics, total number of cases, total deaths, and new cases. So this was almost like a universal metrics being used across countries. Many times, the use of these metrics, such as recovery rate, simple case fatality rate, and risk populations, as well as predictive models, were also made without consulting epidemiologists. And this drew a lot of flack, a lot of criticism from the medical professionals as well as scientists. India's Ministry of Health and Family Welfare itself went to town about good recovery rates and was criticized for not being transparent about predictive models, unlike in the US, where we saw governments, other governments also citing multiple models and the source of those models as well. So if I may just pull you all into the conversation now, beginning with the scientists on the panel, Sandhya, Gautam, and of course Maulik, the physician here. Very quickly, what do you think the media and the government got right through these 8, 9 months, and what did they not get right? Sandhya, you want to begin?
Well, I'm the non-expert here, so to speak. I think one of the things that I felt all governments got right after a point of time is just reporting what they were seeing in the number of people who tested positive. I think there were far greater problems with reporting deaths because deaths in every country is reported somewhat differently. Some cases, people are not tested, but they have symptoms and they pass away, but that's not recorded. And in countries like ours, or even in other countries, for instance, Turkey, someone might, leave the hospital, but may die sometime later of other reasons, and it'll be listed as other reasons, even though they're COVID-related complications. So I think there have been real problems in reporting deaths. Of course, people, when they test positive, are reported. But I think the underlying issue really is that governments, both in India and outside India, are very conflicted on reporting. And that's what you continually see. They want to present a picture where they want to present their nation or their strategy as successful. So they are drawn into comparisons with other countries and say, look, we're doing better. And I think there's a strong desire which sort of shapes how nationally it's projected. And the other thing is there's a strong desire to be seen to be not tanking the economy. And I think those two have been the primary drivers which have sort of led to nations tuning their responses to how the data is reported. Nonetheless, I would say that places which have done well, typically smaller countries which are more homogeneous, or local regions which have done well in larger countries, have been very transparent and communicated risk well and communicated information well. So I think right here you have what you see clearly is that there's real value in reporting things appropriately without sort of being tied up by what are your worries about how you will be perceived. That's all I have to say to that.
I'll go over to you, Gautam.
So thanks, Subhra. So with data in India, there's data that the states collect because health is a state subject. And this is funneled up to the central government, which publishes another set of numbers on their websites. There is sometimes a discrepancy between the state numbers and the central government numbers. States report in a very inhomogeneous manner. So some states do good reporting, some states do bad reporting. Some states who've done well with reporting then later do badly for reasons that we don't understand. So there's been what I think has really come out of COVID-19 reporting of data has been the use of these crowdsourced initiatives where the public just looks at newspapers, reports of states, etc., and combines them into websites that then tend to be universally used. In fact, they're a little more trusted than the standard government data the Indian Council of Medical Research or the Ministry of Health and Family Welfare actually put up. So that's a sort of different approach to data where you tend to look for these crowdsourced, not technically official pieces of information in order to piece together what's happening to the pandemic. And they also give you information as a function of time. which the government reports typically tend to be human readable in the form of PDF files, but not really machine readable. They're not Excel files which you can take and download and stuff. And this is again somewhat unusual because they're optimized to be read by public relations people, by newsmen, but not for use for scientists, for example, who want to try and understand these numbers. On the positive side, I think there's been a lot of very good journalism connected to data in India that questions many of these things, questions numbers regarding deaths, the reporting of deaths, the sort of the many ambiguities regarding testing, how much are people testing, and flags these as issues that we should be concerned with when we think about data in India. So it's a complex picture. There are positives and there are negatives. And the hope is that going forward, there will be a little more trust regarding numbers that the Indian government is putting up, and we will understand them better, and we will hold them to higher standards.
Okay, so let me quickly go over to the data journalist on our panel, Keng. What do you think? How did newsrooms generally tackle the reporting on data? Like Gautam just mentioned, we have had some really remarkable reporting happening in India. We have had the story on underreporting of deaths, as well as other data metrics stories. So what do you think? Because we've seen that this is a heavily data-centric story, COVID-19. And so were the earlier epidemics or pandemics. SARS was and MERS was also similarly data-centric. And do you think because in countries like South Korea, which saw SARS and MERS earlier, do you think those newsrooms were better equipped than, say, other countries?
Right. Thank you, Subhra. So one thing for sure is that journalists are traditionally weak in numbers, right? I always heard joke like, I want to become a journalist because I am bad in mathematics. That's why you become a journalist, right? So those who are good in mathematics in dealing with data, right, they are usually with the business desk, right? They're not reporting on public health. They're not reporting on the society in general, right? However, there's a strong interest, as well as investment in the field of data journalism in the past 10 years, right? So we started to see major newsrooms, usually those are more established newsrooms, started to set up their own dedicated data teams, and they start to deliver more and more data-driven reports using very engaging visuals, right? But that is not across the board, meaning that only big newsrooms can afford to do that, right? And unfortunately, these are newsrooms mostly in the West, right? We are talking about large newsrooms like New York Times, Financial Times. In Asia, the numbers of such newsrooms are very, very few, right? You have like South China Morning Post in Hong Kong, you have Malaysia Kini in Malaysia, and you have certain news websites in Chinese, in China and Taiwan, right? You also have such newsrooms in Japan and Korea. However, in other countries, right, for example, in India, Pakistan, right, we don't see like newsrooms that are coming out with very good data journalism capacity yet, right? So the answer to your questions is both yes and no. For some newsrooms, they are much better equipped to report on this pandemic. And you can see most of the reports, most of the very engaging explainer journalism are coming from these newsrooms, right? But for the rest of other newsrooms, they are still struggling, try to make sense of the numbers. First, they themselves have to understand the numbers. And the second thing is they have to explain and deliver the nuances of the numbers and what does those numbers mean, what are the weaknesses, what are the limitations, what are the assumptions, and all those nuances of the numbers to their audiences, right, in a simpler terms. And that is really a huge challenge for a lot of typical newsrooms that they don't have people dedicated in data. I don't think the past experience, whether you have SARS or not, whether you have other kind of pandemics in your country, is a huge factor. I think it goes back to the capacity of the newsrooms, and I hopefully after this pandemic, newsrooms there will be more newsrooms managers and editors realize that they should really train their journalists in terms of how do you do good reporting by using data, right? And the other point that I wish to raise here is that at the early days of the pandemic, right, the media was also responsible in propagating the skepticism of the public. if you still remember, like at the early days, we didn't have like very clear data on the efficiency of wearing face masks, of social distancing, right? And that time, if you still remember, there are many reports, that questions the actions of the Chinese government in locking down the city of Wuhan, for example. And they are also quoting scientists saying that face mask is not as effective, social distancing is not necessary, right? So we reported all those information. And now when the scientists learn more about the virus, the pandemic, then we are now having a problem to convince the public, that what we reported in the early days, were wrong. We have to update it. We have to update the information. So that brings us to a new challenge: is that how do we report something that we don't know, right? The unknown unknowns, right? That remains a challenge for many newsroom, right? How do we know for sure that this is the correct way? Knowing that reporting it wrongly could cause fatalities, could cause people to be hurt. Yeah. So those are some of the challenges and some of the things that I observed in the past 9 months.
Absolutely, the imponderables, and why this story today is not the story tomorrow, why these two stories are not the same, and the public trust in science, of course. These are really, really some issues that were thrown at us into our newsrooms about data, not just data, but also about how the virus has evolved, how countries are equipped or not, and how exactly are we as reporters, as journalists, uh, equipped to handle that kind of evolving story on an evolving basis. Let me go off to Maulik and Supriya now on the same question of data reporting. I would like to ask you both, one after the other, what consequences do you think uh, good or bad data reporting has had on the public? And do you think it's more important to fact check medical misinformation in real time, or to keep reporting what we know instead of just going back and busting myths or fact checking stuff? Maulik?
So, okay, sure, I can go. Thanks so much for having me here. I appreciate it very much to be in presence of this esteemed audience and this very privileged company. So as I see, there are two different points. The first one is the value of data, and the second one is the impact of medical misinformation. And you can you can see the one. This is still a very new pathogen, new and evolving situation in many cases. We are still learning more and more about the evolution of the disease, evolution of the quote unquote the long COVID cases. So just the way we say the beauty is in the eye of the beholder, the data actually matters to the particular users. And so as you can see, there are three different types of potential users for the data: those who are informed, those who are involved, and those who are impacted by it. And so involved could be, healthcare providers. Involved could be the individuals who generate the data, like the labs. The ones who are informed could be the individuals, the media, the governments themselves, and the impacted could be the governments, the healthcare providers, and most importantly, the patients and their family members. So at the end of the day, the matter of the trust, the data do not exist by themselves. As an island. Data exists within the context, within the infrastructure. They have their own, data are political. They have their own organizational, cultural, and social values that go with it. And that brings me to the second point, which is the misinformation and sometimes just misinterpretation of the data. So if I can just speak from my own experience here, when we started, we almost built the car as we were driving. Everybody did that, right? Like when we started with this pandemic, we had a different case definition of what is a COVID patient, and then what is a quote unquote recovered COVID patient. We remember we needed 2 negative COVID PCR tests 24 hours apart in the very beginning. And then now 10 days later, everybody's quote unquote recovered, which is the case because it's an acute infection. It's not like an HIV or Hep B infection that goes on forever. So because of all of these rapid changes that occurred in a very short period of time, sometimes people get confused. People question why some of these changes are happening and why they are getting impacted by this. And I think that is the root cause of the misinformation that I can think of.
Right. Supriya?
I also agree with Maulik. If you look at data, data is critical to managing any outbreak, and particularly this pandemic. You need data, for example, to understand what is causing the pandemic, more about the virus, how quickly it can spread, the transmissibility, how severely it affects people, and the environment around it that helps the transmissibility or limits it or whatever. So data is critical to manage the pandemic, but data is also critical to fighting misinformation. And one point that Keng mentioned also is that we have to remember, while data is important, data may sometimes have its limitation. Data depends on when, where, how you collect the data, and the environment around it. So when you look at data to understand the story that the actual story that the data is telling you, you need to have it analyzed with an understanding of its context, in context, so to say, right? And I think one of the problems, it's a blessing, it's a mixed blessing in this pandemic, is technology. Now, thanks to technology, you have so much information, and it's all out there, right? But it's not always out there in context. So, sometimes it can be misinterpreted because it's not put in context. And I think that leads to misinformation and the problems it creates. So I feel it's linked. I think it's very important to understand data, but in context, understand it, understand the story it's telling, interpret it within the limitations of how it's been gathered.
Sure.
And therefore, and also the point that Maulik made is, it's a pandemic like we've never seen before, and it's evolving as we go. So there is a lot of uncertainty. So that also needs to be communicated at the same time, and it all needs to be put in context.
Sure. So one of the cornerstones of emergency risk communication is to convey uncertainty in a manner that doesn't confuse or make people complacent at the same time. So that fine balance has to be brought about. Mindful of time, we'll quickly move on to the question on data availability, correctness, and transparency, and how well did governments, Maulik just mentioned, data is political, of course it is. How well did governments fare on availability, accuracy, and transparency? People in many countries were demanding disaggregated data, meaning they wanted to be able to search confirmed cases, say, for example, by GPS location or the number of cases admitted in a hospital near them, etc. But official data always did not have that kind of granularity, that kind of depth, barring in some cases. So the question we are asking is, does the public really need access to more disaggregated data? Gautam?
Yeah, thanks. In principle, no, because all of these electronic tools that follow you that you can put onto your mobile phone tell you about the people you're likely to intersect who are potentially carriers or potentially infected. So in a sense, that sort of information is really useful only to modelers, not so much to people who in a sort of daily life situation. Whenever you make data more granular, there are issues concerning privacy that you must be mindful of. And that's certainly something that governments should be very wary of when they release data of this form.
Absolutely.
Again, speaking only for India, right now, as I said, all of the data that is collected on all Indian patients feeds into the Indian Council of Medical Relations, which really maintains this huge database of the several million Indian patients who have now tested positive. But we haven't really seen any true analysis of that data. There's a lot of information there. And that's where I think the bottleneck is. It's not in the collection of the data, although certainly there are issues around that. but even the analysis of the data in a form that makes it useful to people, useful to calibrate public health decisions across states, across different regions, to make it easier for modelers to understand what is going on and to predict what might happen in the future, that isn't available. So I think that's where I would identify the real bottleneck, and that's where I think we need to do better in making this data free. After all, it was collected with public money. And of course, there's the question of, if you collect data with whatever you do with public money, the public has some right to it, barring concerns with privacy, etc. And that's something that is not really part of our DNA yet.
Mm-hmm. Yeah, absolutely. Supriya again, and Maulik, I would like to pick your brains on what do you think health organizations and researchers, are they primed enough right now to conduct more randomly sampled surveys, for example, zero surveys?
So I can try and speak from my own context, and that is that we have been doing that at least in the location
Maulik,
where I
your
am.
audio is slightly jarring.
Okay, is it a little bit better now? I hope so. Can you hear me well?
Yeah, but I can hear a lot of technical fuzzy stuff. So yeah, please go ahead again.
Okay, can you hear me better now?
Yeah, that's better.
Okay, thank you. Yeah, so what I was saying, I can speak from my own location, my own province's experience, that the zero surveys have been happening. We've been conducting zero surveys, I believe, since June, and they have been so far reassuring in terms of that they haven't shown too much of a community spread. But then those surveys are ongoing. Now, I think if I can go back to the earlier question around the transparency and the availability of the data. And so the zero surveys are one of the many mechanisms that feed into the types of data that the government or the health organizations can conduct themselves or can utilize. Coming from Alberta, Canada, where we have a single health authority for the entire province, the organization does, it seems we do have the capacity to carry out these anonymous zero surveys on random samples collected for various different purposes, and then sort of extrapolate them and slice and dice according to the locations, according to the geography, according to the types of the patients and the patient severity, etc. And remember, these zero surveys were not specifically collected as part of the random sampling. They were we basically just analyzed a whole lot of thousands of samples that were collected as part of their routine blood work, that, for example, that they came for something else, and then the same samples were used, but in an anonymized fashion. So you couldn't really extrapolate to an individual person saying this person is positive or negative. So we still do not use zero surveys as, quote unquote, the immunity passport, or identifying somebody who is, quote unquote, immune or not immune. The zero surveys are for the public health surveillance purposes only, and they are only for demonstrating the effectiveness of the public health response.
Mm-hmm. Yeah, Supriya.
So from my perspective, of course, research and academic institutes have a very important role to play in, analyzing, collecting, contextualizing data. In terms of zero surveys, I believe many countries have done zero surveys across the world. It was initially begun the beginning of the pandemic with Spain, Germany, Italy, and many other countries have done it. Then definitely it has a great public health significance. It tells you about so much about, the severity, who's being infected, which groups are more vulnerable, the spread in certain locations, which are the, and a whole host of public health information. WHO is developing protocols, I think has developed protocols for zero surveys, which can be adapted to countries. So I'm not an epidemiologist, so I don't know the details of it, but definitely WHO has the protocols and has been working with countries. And I believe it's available and can be adapted by countries and organizations.
Sure.
And
So, for all the talk that we are having on data itself and its reportage and accuracies and how academic institutions come in to play a role on that. Sandhya, you've been involved in something similar from an academic institute. And how do you think all of this builds into changing public behavior? That's ultimately what we're looking at, right?
Um, I have to, this is purely from my perspective. I think there are people um, who are invested in looking at the numbers and can perhaps understand it. And here's where I think good reporting is really, really important to clarify what those numbers really mean. And that's often missing. There's more a fear factor when reporting comes. But in my experience, data rarely seems to convince large groups of people. And I think that comes partly because, to have a population which sort of understands data of this kind, Keng talked about newsrooms. The general public really are very, very diverse. And the two components which is missing in that regard, this critical thinking as a means to understand the world around you is not hardwired into populations. And the second thing is scientific literacy. So I often find that these are the roadblocks, along with what I call pre-existing structures of beliefs that people have, where you find it very difficult to get through to them, to convince them that, they don't need to fear it, but they need to put these things in place. And I don't say this lightly because, as Ken himself mentioned, as the pandemic has moved, we have gained more information and more things have come into play. For instance, with masks was a great example, but there are other examples. And guidelines have changed. So when you start communicating with that, that's where scientific literacy comes in. That science, as you understand more, things change, things can even reverse. So sometimes they'll say, you said there was no community transmission. Now you're saying that more than 50% of the population is, infected. And you look at the numbers where you're seeing active infections, it's lower. What is actually going on? So I think these are the problems that, as a scientist, I have found in being able to communicate, not only to family members who are not scientists, but generally to even other scientists who are not following this pandemic. I think that gap exists. I mean, I know people who have a PhD, but then they come around and say there is this traditional system of medicine and this traditional thing, and that's why we should follow that, right? Because you're saying we maintain physical distancing. And I find that very problematic. I want to come back to one other point which actually Gautam talked about, which is data transparency. I think, as I mentioned earlier, national political systems want to use data to present a particular point of view or a particular view of the country. And I think granular data should be available. It should be available, anonymized, so people understand the difference between population risk and personal risk. Your country, your region, or your city, like Mumbai, where I live in, might have, rising cases exponentially. But your local region may have only 5 cases, in which case you don't have to fear doing certain things. And it's this lack of granular data, I think, which doesn't, it really hurts the person who's trying to communicate, as a scientist communicating to the layperson as to, okay, they have to put in place this behavior, and these are the kinds of boundaries that you need on a daily basis and where they should take much greater care, right? So having access to the data, I think, if communicated well, is very important. I don't think you should hide any data. Anonymize it, but let it be out there.
All right. Keng, do you worry about, this is a philosophical question. Do you worry about the impact of your work sometimes? We all crunch numbers every day to get somewhere, right? And to create that public perception about what these numbers mean and to also communicate the risk during a pandemic. Do you worry that that may not be enough, or do you worry about the fact that we strive hard and still make no difference?
The worry is always there, and it's not just there. It actually happens, right? So what happened is that the report that you did, let's say 9 months ago, telling people that face masks might not be that effective, the report might be recirculated again by people, who ask the other, who are against face masks, right? And they say that the same media organization has reported this, right? And people actually just spread the information without looking at the date of the report, right? A lot of time we just do the screenshot and we just share it, right? And we quote the experts, we quote the scientists as saying that, right? So we are actually seeing this kind of old reports recycle, right? Never mind all the other misinformations going on, right? So in this case, actually, many of the journalists, many of my colleagues, we are still learning, so how do we deal with, reports published at different times, and how do we communicate the ideas that, things have changed? It's not that just the things have changed, but things will change in the future, right? What we are claiming today might not be that accurate in the next 2 months, right? So that requires actually a lot of communication. It's not just communication, but a lot of effective presentation of scientific information and data. And that is something that, a lot of newsrooms just realize that, oh, we are not well equipped to do that, right? So right now, until now, I think we are still, most of the media are still doing, for me personally, I think still doing a pretty poor job in actually communicating all this information, right? And this is where I think, it links back to another issue, which is the transparency of the data. If the government refuses to give granular data, right, or the government just give us data in a format that is not friendly for our analysis, for example, in PDF, right? We still get that, in countries like Malaysia, in Singapore, even in Singapore, the government give the data in PDF format, right? And in that case, right, it actually makes our jobs harder, right? We should have spent more time in working on how do we communicate more effectively. But instead of doing that, now we are spending more time to trying to fight misinformation due to the refusal of the government to provide data. Because if you don't give granular data, then people made up their own data. People will start to claim that, oh, there are cases in this neighborhood, in that neighborhood, right? But if we have access to the data in a very granular manner, of course, anonymized, right? Then we are able to find information using those data that are available to us, right? So I think another lesson that we learned during this time is also that how do we build trust between the media and the government, and how do we establish a effective data infrastructure that can make our communication, the data communication between the authorities and media more effectively. So these are some of the questions that have been asked by journalists and have been trying to figure out in many of the countries.
Yeah, sounds almost like utopia to me, having a great conversation with the government, especially for the media. But very interesting points there. Let's jump into the next issue, and a very important one. But something that also is resonating with our audience, we're getting a lot of questions on how governments used pandemic data to make decisions. So this is open to all of you, and please chime in, whoever wants to. Uh, do you think that the decisions around lockdowns, reopening, zero surveys, the public communication around the pandemic were informed by data in most part? And having learned the hard way, do you see governments willing to make greater investments in data infrastructure like digitizing or development of new technology or training of medical staff going forward? Please
Should
come
I
in.
step in,
Yes.
Subhra?
Yes.
So I started sort of reading about the pandemic sometime, early in January, and I felt when lockdown came, for instance, in India, it was in response to what had succeeded in other countries like China and what had not succeeded, for instance, in countries like Italy. So, but that was not precisely data driven, right? That was more that, all right, they seem to be doing well and there are not that many deaths. And in a place like Northern Italy, there are a lot of deaths. So maybe this is the approach to take. I sort of feel, and here I'm going to give a very local example of Mumbai and perhaps Maharashtra, which was in India, was one of the places where there were large number of cases. It was very red hot, lots of growth, had lockdown, and it didn't ease up for quite a while. Where there have been two serious surveys, especially in Mumbai, where some of the highest rates of prevalence were first reported in terms of serious survey. I felt that locally, certainly some governments have later on sort of connected, like the BMC has connected with scientists. In fact, the serious survey was done in conjunction with Niti Aayog as well as TIFR, and sort of tried to use models to inform what happens. But that's local. So I think some big decisions, at least in India and some parts of the world, were based on what were impressions of what had happened elsewhere. But I think more local decisions have been driven by the availability of data. And availability, in some cases, of slightly granular data. At least that's what I have felt. What has been lacking throughout and is an appreciation of lag in collecting data, insufficient testing, not using the private sources of testing. In a country like India, there's so much private sector medical infrastructure, but that information is not always feeding in accurately in a timely fashion into the pipeline. So this, especially in countries where you have two systems, the NHS is NHS in the UK, but that's not the way it is in India. And the fact that you have your testing and contact tracing, and I think we have to admit that in most places you have community transmission now, which is much more reflected when you look at sero survey, that lag, that you're trying to change your behavior after the fact, right? So I think that appreciation has been, I feel, insufficiently understood by political systems. And I think that has really, really undermined the public health decisions of how you open up. But nonetheless, I think later in the pandemic, at least locally in some parts, India especially, I feel this about Mumbai, people have, I think, been informed by the data that's there. How good is it? Well reported? Is it complete? All those issues, including with deaths, do still exist. But I think it's been in one sense.
If I can go ahead, Subhra.
Yeah.
So I don't think overall communication regarding data and how decisions were taken on the basis of their data has been very good. Individual states have done a little better job. But I think the government could have done a far better job saying why did they take a particular decision when they actually did. Speaking for India, what was the motivation behind it, and identifying what the sources were for these models, these projections that they were actually using to take decisions on the ground. And I think that's important. But the other point I want to stress is that problems with data are a universal problem. They existed before the pandemic. And right mid-pandemic is a sort of hard time to try and set these things right. Remember that the medical causes, the certification of causes for death happens only for about 20% of deaths recorded in India. And that's something that was going on long before. The general tendency of government agencies to hold data to themselves, to not share it, and not make it convenient to be used by other people is an old problem. So there are things that precede the pandemic that are really responsible for how we responded during the pandemic. But all that said, I think there should have been a larger amount of transparency. That certainly government should not have made some statements that it did with no indication of what drove a particular decision or a particular action on the part of the government. And I think this general question of how do you make data accessible, which we've been talking about throughout this, is I think a fundamental question that we'll have to come to grips with over the next few months as the pandemic wears off.
I have one comment and potentially an answer to one of the questions. With regards to the request for transparency, I agree. Data should be available. The only other thing that I would mention is if we are making granular data available, even if it is in anonymized format so that individual patient information is not identified, it is often possible to identify groups or communities that can eventually lead to stigma and discrimination against people in particular neighborhoods, particular areas or cities, and we have seen some of those challenges in many parts of the world. So that is one of the caveats that I hope people would consider when they report whatever data that are available to them. With regards to the other question around the government's use of data. And so again, I would go back to the same notion that the data exists in a political structure. And when we have one case of COVID-19, it's a medical problem. But when we have a pandemic, it's a social problem. And so the government's inherent responsibility is to mitigate some of those social challenges that go with the pandemic. Our pandemic plans, as they were before the COVID hit, they were primarily aimed at influenza. Most of the pandemic plans around the world, Australia, USA, UK, Canada, India, they were all primarily aimed at influenza. And so COVID was a new thing. All the pandemic plans told the governments to shut things down. None of the pandemic plans told the governments how to open things up. And so now that is where the governments are all around the world having the challenges. And there are political debates, there are cultural, philosophical, economical debates, challenges, and questions. And so every government is going to take decisions based on their local context and their political preferences sometimes. And so that's where the role of data comes in. Whether the governments use appropriate measures and metrics or data depends upon their philosophy, because remember, none of this was written down.
Sure.
May I?
Yes.
Thanks, Maulik. On that note, I just like to say that WHO has recommends and also has a tool for risk assessment for emergencies like this, outbreaks and emergencies. And as Maulik said, those were actually, we were preparing for an influenza pandemic, and a lot of work has been done for an influenza pandemic, but of course it's useful for COVID as well. And it looks at different factors like the hazard assessment, how hazardous the situation is, the exposure. But to me, what's also very important is the context assessment. They have something called STEEP, which is social, technological, ethical, economic. I can't remember all the things, but that assessment also is needed in order to assess the overall risk situation and then inform decision. That's a tool that's out there in the WHO website and can be adapted by all governments, and we recommend that governments do that and ask all the questions. The context is important because ultimately it's the environment, including whether you have the capacity and capacity to test, the technological thing. Do you have enough beds, hospital beds? Also, how are people behaving? What's the social, cultural perceptions of this? All of that make a difference to the overall risk and should be taken into account. And regarding public communication, since I'm into risk communication, the key point, I think, is listening. You have to listen to people's concerns. You have to understand how they are perceiving the whole pandemic, because what they do eventually will affect the course of the pandemic by their behavior. So I think it's very important to emphasize listening to the people in various ways.
Right.
Just
Keng, you
a
want to
very
answer?
quick comment before we go to the Q&A. Just a very quick comment is that I think this is a perfect opportunity for citizens to highlight the importance of transparency in data and push for more transparency in data from the government, right? Because if you just rely on the government can go both ways, right? Governments that have managed the pandemic well, they might think that, oh, data is good, it helps us to do our job better, and they open up more data. But for governments that have not been performing very good in handling the pandemic, right? They might think that data is a threat to their power. And after this pandemic, they might tighten the access of data by the citizens, right? So we shouldn't just wait there and to see what the government is going to do after this pandemic. But the citizens and the professionals, like the medical professionals, they should now join forces to to tell the government that data is extremely important, especially when we are dealing with this kind of crisis. So we have to, no matter you like it or not, no matter the government likes it or not, we have to build our data infrastructure and make it more transparent.
Absolutely agree. Yeah.
Can I just add one thing there? So I just wanted to say that, I think the public needs data that empowers them and motivates them. But it's important to put data out in such a way that it doesn't confuse them. So data, there should definitely be transparency, but the information should be put in context so it's understood clearly.
Yeah, very fine balance. And God knows who's going to really achieve that balance among all of us anytime soon. But yeah, coming to the question of other countries in the subcontinent, such as Pakistan and Bangladesh, and we've seen very different examples of how all of this has evolved in these countries. There's a question in the question box from the audience. One of the questions that I can see is on the COVID narrative when it is hijacked by the government and military, as in the case of Sri Lanka. How do you get to the real data? So these are really very interesting questions. Like I said, Pakistan, Bangladesh, Sri Lanka, and we don't know about many other countries who are not probably doing data well. So how do you think this is all evolved, and how do you see the scenario on different kinds of mechanisms evolving in different countries? Gautam?
That's a complex question, and I think the only solution is to have health agencies that are a little distant from government, that are quasi-independent, or that independent that they can be, and who are appointed by external sources, and have a term that the government cannot fiddle with. I think that's the direction to go, because that ensures that you do have data that is not colored by any, or the release of data, or the massaging of data that is not colored by any political consideration. I think that's the way to go, but every country has to decide its own balance for itself. And we all countries in South Asia and across the world have complicated politics. There's no getting away from that.
Yeah, quite a diplomatic answer there. Anybody else wants to attempt that?
I think as long as we have governments in charge of national health systems, this sort of intervention is bound to occur. It does not matter whether you're talking about a military government versus something which is not a military government. Some of it is just noise because it's very difficult on the ground. Mistakes can be made. For instance, I'll give an example. In the UK, people talk about X number of tests, but when they're asked how many people it is and how many people are repeat testing, that data is not always available. So it's not something which is a purview only of countries which have, military with a strong presence. Nonetheless, I think here's where it's extremely important that, as I emphasized throughout, sometimes you care more about the narrative than what's happening on the ground. And that really is a values question. So I think each nation needs to decide what its values are. Do they value their citizenry? And this is where I think citizens and news organizations continually need to bring the idea of values, be it in a pandemic situation or not, out in the public and show, and scientists need to intersect with this. Scientists need to be part of that conversation to change how it is perceived, not as, we have to show ourselves as good, but let's look at what's on the ground. We care about these outcomes. Do we agree with this icons? And you can't do this in the middle of a pandemic. These are ongoing conversations. And this pandemic merely shines a spotlight on what is pre-existing because it puts pressure. It's a stress test, right? Like when you have a heart condition, you go and do a stress test and see how badly you're doing. And that needs to be done as an ongoing conversation. I think what I often feel with journalism is interested in certain kinds of stories, but very few journalists and newsrooms are set up to do these big analysis pieces in which especially science is a very big part of the conversation. That, I think, is an ongoing process, which I think the pandemic is identified as something that needs to be done.
All right. We are out of time, but we can take one last very quick question probably. And it is about data journalists. Okay, this one is for you. How much does the element of doubt creep in for data journalists when reporting pandemic data?
It's always a balance between how do we effectively delivering information. So once we say that once we start to visualize the data, right, it gives people a sense that this is very reliable, right? That's why you make a chart, you make a map and show me, right? Once you do that, you kind of tell people that this is very reliable. But at the same time, we need to find a way to tell the doubts to convey the doubts and as well as uncertainties, right, in those visualization, in those content that we deliver, right? So I think some of the newsrooms have kind of figured out a way to show that, right? They are using like a range instead of just visualizing, for example, a straight line. They are now using a range, right, to show that there's a range of errors is going to happen. There are uncertainties there, right? So, but we are still at a very early stage of figuring out, what is the best ways to convey all these, nuances and details, in terms of scientific data, right? I would say that it's a long journey, and we are just at the very beginning of the journey. And as just now mentioned by some of you, that journalists, don't expect journalists to be the expert in conveying information. No, we are still learning, and we are beginners in that, and this pandemic really taught us a very good lessons in terms of responsible as well as effective communication in terms of scientific data.
Thank you very much. We are totally out of time, and I'll have to sort of hand it back over to Anuja. Thank you, all of you. This was a lovely session, I think, and you can always answer the questions on the Hopin chat box even after this. So, Anuja, back to you.
Thank you.
Thank you very much.